Hello everyone and welcome back to Medinos from Medicos. The topic that we're going to deal today is about apoptosis from pathology. The objectives are introduction, the causes, pathogenesis, morphology, histology, diagnosis, and the disorders associated with apoptosis. So what is apoptosis? Apoptosis is a type of cell death which is regulated suicide program in which the intrinsic enzymes degrades the respective genome of the genomic DNA and the nuclear and cytoplasmic proteins. So what are the causes? Basically, there are two causes. One is normal physiological situations, that is nothing to be afraid of, that occurs normally in the human body, and the other is pathophysiological mechanism of cell loss, which might be because of some underlying causes that should not be overseen. So under the normal physiological situations, there is one that occurs when the removal of supernumerary cells occurs during the development. The second is the involution of the hormone dependent tissues during hormone withdrawal. Next is the cell turnover in proliferating cell populations, then the elimination of the self harming lymphocytes, and next is the neutrophils and lymphocytes at the end of the immune reaction. In pathophysiological mechanisms, there is DNA damage, accumulation of the misfolded proteins, viral infection, and pathological atrophy in parenchymal organs after dual obstruction. What is the pathogenesis? We need to know that two types of pathways are involved in apoptosis. One is the mitochondrial mediated pathway. It is also known as intrinsic pathway, and it's the most commonest pathway that causes apoptosis almost in 90% of the cases. And the next is the death receptor mediated pathway or the extrinsic pathway. Two enzymes are basically associated with the pathogenesis. One is the caspases and the endonucleases. We all know the function of endonucleases, so I'll be explaining about the caspases. In caspases, if you see properly over here, C stands for cysteine and ASP stands for aspartic acid. So what happens, this cysteine, it causes a cleavage right before the aspartic acid. They are of two types, one is initiated and the other is the executioner. So the numbers of caspases that comes under initiator is casp 8, 9 and 10, while in the executioner it occurs casp 3, 6 and 7. There are three factors that is associated with the pathogenesis. One is the pro-apoptic factor, that is BAC and BAS. The next is anti-apoptic factors, that is VCL2, VCLXL, MCL1. Next is the regulated initiators of the apoptosis. Under that would come BIM, BID, BAD, PUMA and NOXA. Then there are three stages of pathogenesis: the initiation stage, execution stage and the removal of the dead cell. So firstly, we will be learning about the mitochondrial mediated pathway or the extrinsic pathway. Here an abnormal cell, basically by DNA damage or radiation or infection, it activates the pro-apoptic initiators, that is BAC and BACs. So what happens is this causes oligomerization of BACs and BAC, leading to the formation of BAC-BACs channel. This causes the release of cytochrome C. Once the cytochrome C is released, it combines with APEF1, leading to the formation of apoptosome. This causes a release of caspase 9, which is an initiator of apoptosis, which causes the activation of casp 367, which is an executioner of the apoptosis, causing to apoptosis leading. Now the extrinsic pathway or the death receptor mediated pathway, this is caused by the activation of the plasma membrane death receptor, that is TNF R1 and CD95. This one occurs in FAS. So this FAS has an upper layer for the T lymphocytes and a lower layer where the dead end receptors prevails. So this dead end receptors, they release FADD, that is FAS associated death receptor. This causes an activation of release of procaspase 8. Procaspase 8 then causes the release of caspase 8, which is an initiator of the apoptosis. Caspase 8 then activates caspase 3, 6 and 7, which is execution of the apoptosis, and then it causes apoptosis. Now we will go to the last stage, that is the removal of the cells by phagocytosis. This step is also known as efferocytosis. It's mainly divided into 3 factors. One is the presence of phosphatidylserine. In this, what happens is phosphatidylserine flip occurs, that is the phosphatidylserine that is present actually in the inner membrane comes to the outer membrane of the apoptic cell. This is identified by the macrophages, and then removal of the debris occurs. The next is the secretion of the soluble factors. This is also known as thrombospondin. And then the next one is the natural antibodies and proteins of the complement system. This goes and coats the apoptic cell, and then phagocytosis occurs. The next is the morphology. So what all can we see in a apoptic cell? Firstly, we will see a cell shrinkage. Why would we notice a cell shrinkage? Is because the cytoplasm, it denses. There is a decrease in the size of the cell. Then we can see large number of eosinophils in it, and the organelles gets tightly packed in a cell. So that's what happens in cell shrinkage. And then there is chromatin condensation. We can see over here the chromatin condensation is the characteristic feature that cell is undergoing apoptosis. Then there is the formation of cytoplasmic blebs and apoptic bodies, and then phagocytosis occurs. Now we can see histology. Usually, very rarely we can see apoptosis because of the absence of some inflammatory response in it under the light microscope. But sometimes when we do an H&E stain, this apoptic cell, it occurs round or oval with mass of intensely eosinophilic cytoplasm with fragments of dense nuclear chromatin is present. This is an example of the apoptic cell in a liver cell. Next, how we would identify apoptic cell? How can we diagnose this? We can use a electrophoresis method. We can use tunnel technique. This is an example of tunnel technique over here. We can go by chromatin condensation methods, that is by H&E staining or acridine orange staining. We can also use a tumor marker type of marker, that is annexin 5. Why? Because this causes a binding with phosphatidylserine, which is present only in the outer membrane of apoptic cells. Next is the disorders associated to apoptic cells. If there is reduced apoptosis, it might cause diseases like cancer or autoimmune diseases because of the increase in abnormal cells. But if there is increased apoptosis, there is excessive loss of cells that might lead to neurodegenerative diseases like Alzheimer's, Huntington's diseases, Parkinson's diseases. It can also lead to ischemic diseases like myocardial infarction and stroke, and it can also lead to the destruction of CD4 and CD8 plus cells that can cause to AIDS. So that was the video for today. I hope you like this video. If you like this video, don't forget to like, share and subscribe to the channel. We'll come with more videos. Till then, stay tuned. Happy learning. Bye.